make up to $500 a month. So with spring break being out, our kids made a good amount of money. So,
Oh, so it's not just, it's not DYCD.
no,
Wow. So when they're out of school, they can join like for a month, like 6.
yeah, they can.
Spring?
So they can stay with us the entire school year. We don't meet too often because we understand kids are in school and stuff like
Right.
that. So right now, for example, I'll tell you their schedule is Monday, Tuesday, Wednesday. So Mondays and Tuesdays they come from like 3:30 to 5. Tuesday the same thing. And
Alright, so
then,
we're gonna go more in depth
Yes.
into as you do your presentation. Miss Love?
Hey.
Hello.
Hi.
Good evening.
Good evening.
Go ahead,
My
Miss
name
Love.
is Karen.
Hi, Karen.
Hi,
Some people know me,
Hi.
I know.
maybe some don't.
Hi. And have a seat.
They call me, now we call it Citizen Karen. Dangerous. There's a chair here for the
Miss
TV
Love,
behind me.
Karen, can you sit at the table with us, please? Sure. Miss Love, go ahead.
Okay, my name is Dr. Jackie Love. I am the founder of Grandma's Hands, and we're a small nonprofit, grassroots, that provides services for seniors and older adults. We address food insecurity, food injustice, food inequity, and we try to ensure that our older adults have healthy food choices. We also provide advocacy and assist them in accessing benefits, recertifications, applications, renewals, and things of that nature. And we do programming, both for seniors specifically and intergenerational, inclusive of our youth.
Thank you. Anna?
Can I just ask what can an example of intergenerational?
So an example of something intergenerational would be like our line dance classes, right? We have them and they're integrated for the young people. We take day trips to like the Mets games or to the Nets games where, you know, grandparents can bring their grandchildren for free and have that experience, you know, in spite of, you know, financial constraints, right?
Wow, that's amazing.
Can I have a notepad?
Yeah, we have a game, we're going to a game on June 15th.
So does it have to be necessarily kids and their grandparents, or could it just be kids that wanna
Yeah,
be?
yeah. It can be children who wanna do fellowship with older adults. But if we have a participant who wants to bring a grand to kind of foster a stronger relationship with them, then they get first dibs kind of thing.
Gotcha,
You know.
gotcha, wow.
Mhm.
And where do you find these kids, like from the schools?
Yeah, from schools. I'm a former employee of DOE, and I do work with a lot of youth groups as well, because folks do want that intergenerational
Yes.
piece.
And it's really helpful, by the way.
Anybody
Yeah,
want a
yeah.
pen? to
So,
take
and you know, part of the programming that we offer is check-ins. You know, we have a lot of older adults still live in the community, but they don't have people who are around to check on them, make sure that they have food, make sure that they're taking their meds, things like that. But they also may not qualify for home health care. Right? So you call us, or a child may call us from Virginia and say, hey, can somebody go check on my mom? You know, I can't get there for another few days, but if you can call me a video call or something and let me know that she's okay, then I'm okay. You know, so those are the kinds of things that we try to do to support our family.
Okay.
Go ahead.
Hi, I'm Arna Lipkin. I'm with Connect, which is under the umbrella of IDCC, right next door to our partners Diaspora. Our program being within the mental health system, the idea of it is to enhance mental health, so we help out with things like housing with benefits, all kinds of benefits, food insecurity as well, and a little bit of vocational. And we do events throughout the year based on a lot of our feedback, because we do surveys in the community. So we just started now doing this farmers market. Our next one is coming up May. I'm just gonna pass this around so everybody can come. We have like the mobile truck with Campaign Against Hunger comes now. We give out $15 vouchers, and then if people want extra, they can buy, but it's low cost. So like the eggs, for example, are $2 versus, you know, $3.50, which I paid in the supermarket. It's really, really nice. All fresh fruits, vegetables, some honey they were selling, mushrooms, you know, it was really, really nice. So we're gonna try to be doing this once a month. And here it is, I'll pass my flyer, here's the Connect program as well, so pass this around. anybody that needs our services. We also have therapists within Connect, but our program is 18 and up, and then the clinic is 0 and up, so it kind of intertwines.
Okay, thank you. We have two individuals who just came in, so I'm gonna ask our two newcomers, please.
Oh, I'm sorry, well,
Please introduce yourself.
my name is Karen, I'm a community member, I was sat on on the transportation committee for the longest while. Haven't participated that much lately, however, my main influence right now, or what I'm working on right now, is to maintain, Downstate Hospital, because, I fought very hard for a very long time to try to keep Kingsbrook in the neighborhood. We had a lot of fancy footwork and a lot of political stuff that we didn't know what was going on, and we had when we went to battle, the concrete was already dry on the project. And now, if you go look what they promised us we would have, it's nothing there. Which nobody ought to be surprised at that, but that's what happened. And so when the issue arose,
So, hold on a minute, we have an update, we'll be, having a section for update on downstate. So I'd like you to give a little bit more.
Okay.
Give a little bit more.
carry on then.
Hi, I'm Raditha Abraham Nichols. I'm also a member of the community. I work at Downstate. I am the chapter president of the biggest union that's within Downstate. And so I'm here because I feel like one of the things that was the failure the last two times that they tried to close Downstate was the community. And what we need is the community to work with us to reimagine what Downstate should be. It should not only be the people in the building, it should also be the community. So I'm here because I feel like I need to participate and work along with the community into whatever happens next.
Thank you so much, and welcome. I'm happy to see both of you here. And you are just right on time because our next segment, our next bullet point is downstate on the agenda, right? And then, as anything else, I'm very happy that you guys are there, so you're able to give first-hand information, because we know that it's an injustice for our community at large, and it will impact the closing of downstate, will impact the entire community, not just our district, but the entire community. And then persons who not brought to the table, there was no discussion or anything. I just heard downstate is closing down, and by the way, and even persons who work at downstate didn't know anything about it. And even when the first meeting was called and we attended the meeting, the persons who were supposed to give you first-hand information and let you know, it was very disappointing as to the information that was given. So I'm happy that the two individuals were able to give us first-hand information. I'll give you 5 minutes, so you can give us some more information together as to what's happening and where we are right now. Because I get conflicting information.
So what is happening right now is that we got the $100 million, which is the operating money that we needed to keep us operating. And then we also got another $300 million that should help with the infrastructure costs. By what our president has sent out of the hospital, Dr. Riley, there's another $750 that can be used to create outpatient and limited services, inpatient services at Downstate. But the governor has commissioned a 9-person advisory board. I think that the chancellor will be on that board. There'll be one from the 2 community boards, one from the Senate, one from the Assembly, and I don't know where the other people are gonna come from, and one from the union, the largest labor union, which would be the union that I'm a part of, on a board. And by April 4th next year, they'll give recommendations on what should happen with the facility or what it should look like in the future. It is a concern to us because there are no real clinicians on this board that can, give them that insight. And if there isn't gonna be, and we get that, there should be something in the background that supports them where they can come to for information, and some community people that know the history of downstate that also can be supportive. One of the things that I'm very concerned about, and we are the community, is that decisions about downstate is being made 168 miles away. And we have the talent right here in Brooklyn to help make those decisions. But it seems to, every year we beg for money, and we should not be begging. The other thing is that hospitals are created for public good, not to make money. And so if
Exactly.
we fall even, that's what we should do. It shouldn't be on a business plan.
Right.
We've changed it. And what we really need to look at is Medicaid reimbursement. Because I think that's a form of injustice, that if I go to the doctor on Medicaid, you get 60 cents and somebody else get $2. How do you think you're gonna treat me? So that's already discrimination. And I think those are the larger issue. And one of the things, right, I'm not happy this happened, but I think it alert the community what's really happening. They're building all these big buildings. Where are these people gonna get health care? Where are they gonna go? Right? It's not Kings County. And so why shouldn't the people of Central Brooklyn have choices between more than one facility? Why should it only be Kings County? And why are you telling us what it should look like? They keep saying we're empty. That's not true, because anybody that knows hospital operations, because I worked in the hospital, I was a nurse manager in the ED during COVID. I know how, I've worked as a nursing supervisor. A bed is not a bed is not a bed. So that's not a great argument about what should happen next. And so we at Downstate believe that we've won a battle, not the war. And so people should not be quiet during this time. We heard that there are gonna be 3 public hearings. We expect people in the community to come out. You know, we will give that information. We have to come out strong, because what I'm gonna say is that it is the community that got that money. It was, the community came out and supported what we were saying, but without the community, they would just have said that we want jobs, right? But when the community stands up and says, you can't take this out of our community, you did this to Kingsbrook, you're not gonna do that with Downstate, that comes off very differently.
Okay. Well, I'm from the community perspective.
And we met during this fight,
Through
because
this-
she's from the
through this
community,
battle.
yeah.
Because, as I said, I fought about the battle for Kingsbrook. Matter of fact, after it was over, the people at Crane's New York Business called me and they said, can we do an interview? I said, do an interview. I'll do an interview. And after she did the interview, she said, you're really interesting. Can we take a picture? I said, sure, take a picture. So they sent the photographer on the coldest possible day. There's a picture of me on the front. I said, where are you putting this picture? She said, above the fold. I said, oh. So on the front page of the Crane's New York Business, and the thing that was so important to me was I took it down and they made them send me the actual paper. I cut it and I put it on a poster, because I'm artsy like that. And my son said, Mom, what is that for? I said, that's for your kids and your grandkids,
Wow.
so that they know that grandma stood up for something.
Beautiful.
Mhm.
Love that.
That was my mother's hospital.
Mm.
Downstate is my hospital. So my question is, if I have to go to the hospital, where I'm going? This is a problem. And if I don't fight for it, then who's gonna do it? The problem that I have is, I believe that with the commission, and I read very well, I read the legalese, because I was the president of a labor union, so one thing that labor union presidents have to do is learn how to read the legalese, especially when you have a small union. If you have a big union, you walk down the hall and you throw it on Sam, your lawyer's desk, and he has to handle that. If you have a small union, then you have to read the contract yourself. So the obtuse language which they are using for the design of the commission already lets us know that they have the questions and they have the answers. The only thing the commission needs to do is to put the middle to make it look good. I don't intend to allow them to do that without a fight. I'm not in a political position where I can't make noise. I I've talked to the borough president's office today, I talked to the chairman of this committee here today, and probably in a couple of days, I'll talk to the other political people, and pushing makes things happen. And the more people that push, the more things happen. Because, don't forget, as I said to Miss Kathy, you need me, and you work for me.
Yes, she does.
I don't work for her. And this is and we have to let her know that we know that. And we understand that. And we want this hospital to remain. I do not want them to get into this commission, which is what they did at Downstate. See, they laid the predicate. We already know the process of what they
At
did
Kingsborough.
because we saw what they did at Kingsborough. They came with, I'm trying to get a copy of it. It was a real slick, like about the size of this, the Northwell study, and it was, slick paper, and, this is what, but what it was they came with the front page. They already had the back page. They knew what they were gonna do. We can't let them do that this time. So, that's how I've engaged myself with it, and there are a few people that are working with me because we all have to feed each other, because energy is the thing that keeps it moving. And people have said to me, well, what can I do? I said, do what you could do. What do you do well? I'm not that computer girl. But there's some people that just whizzing with that. And can you make flyers? And I say this to people all the time, do what you can
Social
do.
media, sending.
If it's only call your friend. Tell your friend to call their friend, so that we gather enough power, and prayer counts too.
I just feel like we have this unique opportunity, unique history, and to show our elected officials we know what we need, and they need to listen to us. And times are changing; they need to listen to us. We know what we need.
But if I may, you do have the support of a senator and the
Yes.
assembly. I think what you're really referring to is the governor.
The governor.
She's
yes.
the one that's,
It is the governor.
because you
Well-
have the
Well,
support
they're
of
in the
your,
community, so they're part of the community, the senator and the assemblyman.
so
It's
they did push.
Yes,
That's
they
why
did.
I was told that they wouldn't sign the budget.
No, they
unless-
did not.
And then they stuck together pretty much.
Senator Myrie and Assemblyman Cunningham, yes, they
And I
did.
believe some of the East Flatbush people too.
Yeah.
Monique
Monique
and
Chandler,
some of the others.
yes, and also
Waterman, yeah.
Waterman, she stuck with us.
Yeah,
And also, even though she's for the city, Rita Joseph,
yeah.
she supported us a whole
Oh, yeah.
lot during this fight. She says, I'm from the city, but I'm gonna do what I can do for my end. So we
Right.
do have a lot of support. But who holds the purse is the governor.
But there's another election on the
Yes.
horizon.
Well, we've been reminding her of that.
Good.
No,
I mean, I better shut it.
Nothing. I
I don't know
called
anybody.
today to the governor's office, to Albany, to try to determine, because this information seems to be very ethereal, it's just kind of floating around out there. So I wanted to know, since I see the document, I have the original document that Representative Assemblyman Cunningham wrote, and I've been given to understand that actual document is in the budget somewhere. The budget's a few thousand pages, so I wasn't able to find it. However, I said, okay, let me call Albany. So I called the governor's office and I said, who is it exactly who is formulating, convening, choosing the people to be on the commission for Downstate? She said, pardon? I said, oh boy.
Well, the chancellor was at Downstate today, and he did meet with the faculty senate, and really not the people from the hospital. So of course he wouldn't meet with the people from the hospital, but he did meet with the faculty, and it seems that he has not changed his position on what happens next, and he will be one of the members on the advisory board. So we're just waiting to see what happens next.
Which is that angle, but from the angle where I am, I just wanna know does it, where is the buck stopping besides the, and when you put, I have a lot of patience about calling around and holding people's feet to the fire when they don't know. I said, okay, so how, I don't understand, you don't know what I'm talking about? No, I don't know. So, nobody knows nothing. I spoke to 3 people today in Albany. They don't know.
I have one ask of this, if they can advocate for one thing for us, is that these meetings be open to the public.
Yes,
So if there's anything we can ask you to advocate for, when you do advocate, is that these meetings are public when they meet, so we can know what's going on.
absolutely.
You
Yes,
know, they
definitely.
made a, what was it called, a little, a stakeholders meeting, there was about 40 people, they called together in downstate, you know, a couple months ago.
Mhm.
People from the community and stuff, there was one of these meetings, so it's not like the community, and then they brought people from their office to listen, whatever, and take notes and stuff.
It really was not a community.
It was not a community.
Because
It wasn't.
we wouldn't have 40 persons there.
Yeah.
You know, so as we
True.
move on, thank you so much.
Okay.
And you know, I serve as one, as the chair for the review board at Kings County Hospital. And when the CEO called me and then he told me what was happening, his concern was that, how will we be able to service the people, the community? Because here, when Kingsbrook shut down, we had at least like 60 to 80% of the patients, they went to downstate and Kings County because they find that interstate was too far, as well as Brookdale.
Brookdale.
So everybody were in flux as Kings County and downstate, and now you want to shut down downstate. So what happened? So we don't have the space. And they didn't really ask the question. They said, well, they will be going to Kings County, and we don't have the space. Right now, we are trying to make space for our patients, so we don't have the space. So it really was very unnerving as to what will happen to the people, because like, hey, our people will be walking down the street and just falling, dying. You know, people who usually like things, Matthew Eugene, when he was in office, he
Yes.
brought in the dialysis section at,
Yes.
at Dumpster, so persons won't have to travel from
Yeah.
here to Manhattan, you know, so then that's what you're sending them back to again. But as we move on, because of time, the first demonstration they had, it was cold, that's why we didn't have that as much persons coming out, because I was looking to see the whole of Claxon Avenue,
Yeah.
you know, covered, but they didn't have quite a few persons that turned out. And then we need to make our voices heard. And whatever organizations that you're attached to, you know, just, you know, put the word out there. We need to come out, we need to shout, we need to scream, but we are not doing it by ourselves. We're doing it together. We are holding hand, and then we are doing it together, because as we hold hand together, then there is power, you know, and then we can push because our voices were not heard for Kingsbrook. And then our voices have to be heard for downstate, you know, because we need that hospital right here.
I don't know if everyone knows, if I may, Francesca, but there is something unique about this hospital in that it's the second best teaching hospital.
Exactly, yeah.
I
Of which
actually went
many
there and
people-
graduated in
Yeah.
downstate. Yeah, and public health at that, so, and my concentration was in policy.
Yes.
So it's like, I knew that they were going through like the possibility of closing, but hearing you guys speak, I kinda got a little sad. I'm like, Suzanne, you need to do a little better. Like, I had no idea that
Yeah.
was going on.
No, but you wouldn't know if they didn't put it out there.
Yeah,
because
it's
this
like you
wasn't in
hear
work
this
since
hospital. I
2013.
didn't even know Kingsbrook closed down, and I worked 2 blocks away.
Yeah. They
You know?
did it very quietly.
Yeah.
They did it
Yeah.
very nasty.
Okay, so as we move on, we have to cut
Yeah.
to 10 minutes per person because I have an 8 o'clock meeting,
Okay.
and that's my history of my life. I usually have meetings back to back. So Heights and Hills,
We'll be quick. Megan, you wanna start?
I
Go
will.
ahead.
Thank you again, everyone, for having us. Ms. Leopold, thank you. My name is Megan Nelson. I'm joined by my colleague, Tiffany Manella Velez. I am the director of the Family Caregiver Program at Heights and Hills. Tiffany is the director of the Case Management Program. Heights and Hills overall, founded in 1971. We've been around for quite a while here in Brooklyn. And for that whole time, our focus as a non-for-profit agency has been on supporting older adults in the community. To that end, we now have 4 core programs: case management, caregiver, volunteers, and our Park Slope Center for Successful Aging.
Where is it located?
So our main office is located
Oh,
at
the
81
Park
Willoughby
Slope Senior
Street.
Center.
Oh, the senior
I
center.
just met someone
So the
there.
center is at 7th Avenue and 7th Street in Park Slope, right across from Brooklyn Methodist, New York Presbyterian Brooklyn Methodist.
Yeah.
Yeah, formerly known as. Tiffany, I'm gonna turn it over to you to talk a bit more about case management.
Yes, so briefly, the case management program, we service clients over the age of 60, and we are funded by NYC Aging, formerly Department for the Aging, and we do Meals on Wheels, friendly visiting, and we do have a limited home care program called ISEP, which stands for Expanded In-Home Services to the Elderly Program. The way that is paid, it's not associated with an insurance or Medicaid. It is based on a person's housing expenses and income. So a person can be a contribution only, all the way up to $25.50 an hour. Most of our clients are contribution only. So that's the case management program. Again, typically the clients have to be homebound, but that's a very loose term. Homebound could be they can't walk within 2 blocks. We have clients, So what our focus right now is we have a ton of clients who are facing evictions, who are struggling with substance abuse, diagnosed, undiagnosed mental health concerns, food insecurity, which is why, hearing about your program is fantastic. I was unaware of that. We have a ton of clients where we're constantly buying groceries for them, or we're going out and bringing them emergency bags. They have absolutely no support in the community. So that's just in a nutshell. I know we're in a time limit, case management in a nutshell.
So when you really light bulb went up when you talk about eviction. So that's one of the areas I would really like you to take my information,
Yes.
because I work with the New York City Commission on Human Rights, and then we do my job is to go out there and really educating persons as to what their rights are when it comes to housing, and housing, public accommodation, employment, it's discrimination. And then I really push for the older adults, because when it comes to accommodation in their homes, what the services that they're receiving in their homes. So please take my number,
Yes.
and then I think I don't know if I have any cards, but I'll give you my information, and please connect with me. So any persons who have any issues with eviction, whatever that because we mostly deal with discrimination, but if based on what the complaints are, if it does not fall within our jurisdiction, then I will refer them. I can call Housing Court Answers or some other organization to really pick up, the slack, and then try to give the service as needed, because that you really touch a core there. So the services that you're talking about are the services, and the next thing that you said, the services that you're giving. Do you also get pick up medication for the older adults if need be?
So we don't do that, but the ISEP program will, or we can help connect them to somebody who will. So it's we really try to take a holistic approach to case management. We're obligated to connect with the client once every 2 months, which we connect with them more than that, and to go to their home once a year. We typically are going out more often because the needs, especially over the past, I want to say 5 years, at least what we've noticed, is they're becoming more complex and more challenging, so we're going out to the home more. So if somebody does need that, we will provide them with the resources for it. We will try to connect them with that, just so that they can remain within the community successfully and have a good quality of life.
Okay, so you're saying yearly that they get a visit, so they'll have other persons who then would visit them to make sure that the care and everything that they're receiving for.
Yeah, the case manager, they're assigned
you
a
would
case
be-
manager.
okay.
Yeah.
Right, so
Yes.
one of the beautiful aspects of the way that case management is paired with Meals on Wheels in this program, most older adults who reach out to us say, hey, I heard that you do Meals on Wheels, can I get some meals? The meals are the thin end of the wedge, because if you're receiving the meals, you're also going to get a case manager. And that older adult, they might say, I don't need a case manager, just give me the meals. But having a professional person who is part of your orbit, who's part of your world, who's checking in, who's doing those assessments, who says, hey, it looks like you're having more trouble paying for groceries this year than you were last year. Can I connect you with a group that can help you apply for SNAP benefits? can I help you explore what other benefits you might be eligible for? It enriches that person's life and it opens up more opportunities for them, especially when issues like housing instability become part of the picture.
Okay, and then my last question before I go to the diaspora. During COVID, we had a lot of issues because COVID, persons were not getting the service that what was needed because the persons were not allowed into their homes. They were not able to get the medication, and one of the things that was the meals. Because they were complaining that they don't want to accept the meals because of the preparation of the meals, because certain underlying conditions that they have. So in the servicing of the meal, are they really looking at the health issues of those patients before those meals are prepared?
Yes, absolutely. We are able to, I'm sorry, I'm jumping.
No, go on.
So we are able to send meals that are customized both to clients' individual health needs and also to their cultural needs. We
Oh, wow,
offer
that's good.
kosher, halal meals. What other varieties of meals do we offer?
There's kosher, halal, Latin, vegetarian, Caribbean.
Wow.
Yeah.
I'm trying to think of what else. There's also hot or frozen. So frozen's delivered once a week, hot's delivered 5 times a week. So yeah, it really depends on the
Depends on
client.
what
Okay.
you need.
Wonderful.
Absolutely.
Any questions before I move on to any questions for the ladies?
I have one question. What about the migrant population? Would they know where fit into this at this point, right?
For our program, no, unless so we work with those in the living within the community.
Yeah.
So we don't work with, the shelter system,
Okay.
unfortunately.
Okay.
They
So
won't be
no,
under this
yeah.
umbrella right now.
Okay.
And if you would, Ms. Leopold, I just want to give a very brief, another quick plug for my program, which is our family caregiver program. Again, we are here supporting those informal family caregivers. I know when I spoke earlier, I mentioned specifically people caring for someone who's 60 and over. We are also able to support people who are themselves 60 and over, who are caring for a younger relative who has a disability. So that older mother who's caring for their grown child who has a developmental disability. We can support people who are caring for someone under age 60 who has a dementia diagnosis. So that spouse who's caring for their loved one who has been diagnosed with young onset Alzheimer's disease. We are also able to support kinship caregivers. So grandma who has custodial care of her grandchildren. Anyone whose age, actually the age limit is a little lower, someone who's 50 and over who has primary custody, who is raising that minor kinship child. So Dr. Love, it's so lovely to see you again. We might need to talk about making some referrals between our programs.
Absolutely.
Thank you so much. All right,
Thank
that's
you.
all.
Thank you very
Thank you.
Okay, after, as we move on, anyone, I can take one last question? Anna, you had a question?
No.
Oh, okay. Thank you so much, and I'm looking for us to collaborate and work together on the community board and as well as on the outside, when it comes to the work that we do, especially the Commission on Human Rights.
And I'm just gonna
Yes, please.
All right, so it might be easier. DCS, as you guys can see, has
Just
a lot of programs. I also have some slides for you guys. Yeah. So there's like hand sanitizers and cans. Feel free to take what you like. Okay, yeah. So you guys have the guide, so I'm just gonna speak, I guess, briefly about each program. I'm not gonna read the whole thing because
Yes.
we don't got all day, and I know you have your meeting. So I'll start with ECD, for example. I'm not gonna go too in depth with that one because that program is kind of phasing out, so I'm just gonna skip it. There's Connect that Arna is very familiar with. Connect also works with youth, similar to my program. And they focus more so on substance abuse and HIV, Hep C prevention with the youth. So they go and they teach like students and they do burpers, the importance of like, so they teach substance abuse prevention. So Francil, who is the lead navigator for that program, does a good job at doing Narcan trainings where youths can be, Narcan trained and distributed. And once you're trained, you can train other people. She also has great resources where she can get like fentanyl test strips, stuff like that. And we do these workshops in schools, in shelters. We do a lot of outreaching in the community. So that's a little bit about Connect. And like I said, DCS as a whole offers free Hep C and HIV testing year round. It's only 1 minute, confidential. You can walk in there and say your name is Pizza Brown, and we're not gonna double check that that's your name. And we do great linkage. So if, let's say you come out preliminary positive, because our testing is preliminary, we at one point used to send people to Kingsbrook, but it's not there no more. So now we have to now find other community partners to, link our clients to. The residential services, we have 2 transitional houses. One is Connect also, and that's for LGBTQ, male identified youth. So, that house is just like I said, transition living, ages 16 to 20 and a half. And we also have MGH, which is for young females. At one point, it used to be just for I don't wanna say teenage moms, but that's what it was for. Also serving the same age, 16 to 20 and a half. But during that time, we are working to get them stipends, and vouchers so that they can get their own apartments and stuff like that during that time. The CARE program focuses on LGBT awareness as well. We do have 2 sanctuaries that DCS kinda has now for the migrants. I think there might be more. So the CARE program does a lot of work with the youth at the I don't wanna call it shelters, but homes for people. But another part of their program also focuses on inter-partner violence and sexual assault. So that program does she's a social worker, so they do one-on-ones and connect them to other people. Women of color focuses on HIV prevention and awareness education workshops to women of color in the community. I particularly started at DCS in that program. It also offers free HIV and Hep C testing. Incentives, so when you complete the workshops, you get gift cards, Metro cards, a really great program. PSN, it's kind of like the hub for DCS, they do everything. MHAT is pretty self-explanatory, mental health awareness trainings, so they can come to your organization and do mental health trainings for your staff. These things are all free. She has really great giveaways as well. And we give a lot of giveaways, so you see how I bought stuff, we give a lot of giveaways. Maternal health is a new program. They just had a really good event. I know this week is Maternal Health Week, or maybe it just passed.
Yeah.
And I don't know how to go more in depth other than they offer resources to mothers who are expecting. VIV, which is advocacy. Once again, that program focuses on art and HIV stigma and prevention of HIV stigma. I work closely with this program. We do a lot of great murals and artwork with youth. I wish I could show you guys a picture, but I'm just trying to talk real fast. But we've done 2 great murals with the SYEP students when we work with them in the summertime. And the advocacy program focuses on advocacy as well. So when we do workshops with the youth, we talk about what issues affect you the most. And for me, for example, dealing with youth, most of the kids speak about the fact that they wish there was more mental health services in schools. It's hard for me to work in the schools because I feel like I had to learn not to, I'm this much of an impact in their life and their day, Because you might see a kid that's not pushing themselves hard enough, or they're not trying, or they're coming to school first period is 8 o'clock in the morning and they smell like marijuana. And I literally ask the kids what's going on? Or why do you come to school and act out? I've had a child tell me this is the only time I get to be a kid. When I go home, I have to be the adult, so the younger siblings and stuff like that. So I like to ask the students, but our advocacy also asks what would you like to see more in your community? Is there an issue with gun violence? Is there an issue with mental health services? Or we could go on for days about issues. My public health brain is working right now. All right, and then this STAR, that's my program. Like I said, we do sexual health prevention. We do stress abstinence, I tell people that all the time, but as adults, we understand that kids are gonna do what they wanna do. But we just tell them, if you are gonna do certain things, we give them the necessary tools. So we let them know where they can get contraceptives, we show them how to put it on properly, which is important. We also talk to them about, like I said, other things, including advocacy. So we talk to them about, what do you want to do for college? Do you wanna go to college? We also don't force college on them. A lot of them think they wanna be a TikTok influencer. I don't have that. So I usually tell them, okay, you can get a degree in business, okay, so you know how to market. your TikTok videos, or I like to flip it like that. We help them make resumes and stuff like that. And like I said, we employ youth year round, and it's stipend based, tax free. They can make up to $500 every month. The only requirements is 16 to 24, and they have to be in school. But we have a youth right now, for example, that lives at one of the transitional houses, and she could really utilize the extra money. So we're not gonna say you have to be in school, you know. But our goal is to try to help her. Like maybe you want to do vocational school. Like we're there to be a resource to them. If they come to us and they need something, we are, you know, gonna try our best to accommodate them in any way, shape, or form. MBAP, medical benefits assistance. That program focuses on making sure that anyone who is HIV positive has health insurance. So if you do not have health insurance, they directly help enroll them. Once again, we work with Downstate for that program because Downstate also has the STAR program. They're like Downstate, like Brookdale does. So yeah, we usually do a lot of referrals with Downstate. So once again, I didn't know it was this bad. And Health Homes. So Health Homes is a Medicaid health program. So they basically are like caseworkers, you know, for people who are living with HIV. So you have to have 2 or more, I don't want to say illnesses, but you could have a mental health issue, HIV, or you could have
Comorbidities.
yes, thank you. Any 2. There's others, but I'm blanking right now because I feel like I'm talking really, really fast. But yeah, so these people go, they help, like, even if you need help filling out a form, like, I don't know how to fill out my SNAP application. The caseworker will help them do that. Or I don't understand what the doctor just sent me this long letter in the mail. Like, they're there to be like, this is what it's saying, and stuff like that. So yeah, DCS has a lot of programs. I feel like there's programs that I did not mention. But this is a great, resource. I just gave up a little preview.
An extra one.
Yeah, you can have as much as you like.
So I work very closely with Diaspora whenever they have programs. I usually
Anybody else want to?
go to your location at 921, or else sometimes they have programs at the Armory. So I usually attend the programs. And in as much as it's more convenient for us to be meeting, we are home and we're meeting on Zoom, but it's even more important that we're meeting in person, that we're able to see each other. And one of the things that really gets to me, you know, we have meetings and then we have persons, they come around the table, they would talk about all the services that they bring to the community, but afterwards when they say bye and then they shut down the computer, we don't hear them again. We don't see them again. And each person here is a link. And then we have to link, and when we meet, each person brings something vital to the table. And as we meet and then the conversation continues, the 2 of you may not be the ones who are able to come to the next meeting, but if you send someone to represent you, something is said, somebody come with something that could enhance your program that they could take back and we can use your program. And then that person self may have something that happening with them that you can use. So I would just, as anything else, what you gave, it's vital, and I'm looking forward for us to be able to partner and work together. Dr. Love, we've been working somehow the other with Slide. I don't know what happened. We lost that connection because you're so busy and I'm busy. But I'm really looking forward for us to continue our work. Last year, we collaborated together with Kings County Hospital, and then we did a study for the seniors, and then she really had the seniors were very happy. They had pedicure, manicure, they had massaging, they had laughing yoga, yeah, they had bingo, they had so much. And then, you know, she got food for 150 people from, they came and they got their food, and then she got popcorn and everything, and it works for them. So we had a wonderful day. And when the seniors were leaving, they said, are you going to do this next month again? So I'm really looking forward to us doing it this year, maybe at a different location, you know, so where the seniors will come, you know, and we just come for them.
Well, let's do it downstairs.
Yeah, we can do that.
We can definitely
Yeah, we could definitely do that. So because I mean, we are bringing services for them. It's yes, and they want the services, they want the food, they want the medical, but sometimes you just want to relax. You just want to know that hey, you know, your person's thinking of us, they care about us.
Self-care.
You know, and then and
Pampered.
I am happy with the work that I'm doing because at my job I work with the attorneys, sitting behind the desk. And when I realized what they need in the community, I came out of that and went out in the community. And I saw there is a need, especially for our seniors, the services. So the work that you're doing, it is so vital, it is so important. And Anna, we work together, you know, always at her meetings. You know, they have a great program. They're side by side, next door to each other, and East New York. And then she's working with, I think, Miss Connecticut working. We're working with for the shower in the city.
BCS
Yeah, can you give us
primarily.
give us a little bit more?
Sure,
on that?
okay, so we do this, our big event that the last couple of years is called Shower in the City. And I'm adding health and resource fair because at our last meeting, everybody was saying, you know, what does that mean? Like, I'm getting a shower? Okay. So it came out because there was this shower bus. I went to this event before I started with Connect, when I was with Lori
No,
Combo. Lori Combo, no, Darlene, actually, Darlene was right on the corner. And it was like the shower bus, it was a halal truck, food, and some clothes. It was like 3 or maybe 5, 6, 7 vendors. But I love this idea of the shower, because you think about homeless, they need a shower. And, you know, anybody could come. So I proposed the idea to my staff, and they really liked it. And then we got in touch with BCS, Brooklyn Community Services are the ones that manage this shower bus, which, by the way, was started by our mayor when he was borough president. So I'm not sure if there's 1 or 2 shower buses. If they're not 2, they're working on it. Anyway, shower bus goes out to like Bushwick and certain set areas, but if you ask them for a special event, they will do it. So we got this event, we did it usually in August, but we're trying to do in July for different reasons. And then we have a lot of vendors there. All of you are welcome to join if you'd like. Last year we had about 40, and I've already looked at, you were there, right, for sure. I'm looking at my spreadsheet, it's already 50, but I've gotta tone it down, it's a lot to manage. So the point is to give, you know, not just homeless, but also low income, the resources and some giveaways that, you know, just to make their day a little bit brighter. So of course the showers there, we had 67 Precinct was a big partner, because they actually, I gotta give credit, they're the ones that started this, God Squad. And then different vendors throughout the community that can help in different areas. And again, BCS, we have their contact, you know, they book out, but maybe, you know, if you know of an area, again, it's really for where you know that there's homeless. East New York and Bushwick, that is their prime area, they go every week.
Yeah, and one thing that I'm looking forward to, Justin, I'll give you a chance to say something in a few minutes. If you do have for the truck for the HIV testing, that would be very good, because sometimes they ask, and I remember last year when we did, the young man came to me and said, do you really do any HIV testing? But even at the One Crown Heights festival event that we had, and persons came up to my table, they asked as well. So, you know, so there's things that we have to,
People don't usually ask.
yeah, well, yeah, so I think that it would be a good thing to have one of the HIV testing on site, so
Yeah.
person who wants
Did we
to.
not have that last year? I thought we did.
So we test in-house, of course, but we also have tests like tents that are like confidential, where they're like blocked off.
Right.
So you can like come in the tent and do it, and then, like I said, you get your results literally in seconds. And you just,
Yeah. So last year I did, every year I have a resource fair at Hillel Plaza down on Flatbush. So this is August 8th. And Caribbean Women Health Association, they had one. They had a HIV,
do
yeah.
you share
yeah.
these events?
Hmm?
Do you share these events?
Oh yeah, sure.
Okay.
Yeah, I'm just waiting for the flyers to come complete, so
Okay.
I could send it out, and you know, I keep asking person in the community, so I will send it to you guys as well. So because we want the more information that people in the community get, you know, it is very important. I get really angry with persons in the community, and when I do presentation, I get on their case, and I said I make no apologies, because you have tables upon tables with information that they need, and when they pass, they see the pen, they say,
Yeah.
oh, can I have this bag? Can I have this bag? Can I have,
You see,
you
it's
know?
stuck with me. I can't go nowhere without stuff.
And
I
I'm
feel
like, hey, I said, look, I didn't come. I'm sitting and I'm watching them, they pick up a pen at each table, and when they come, they don't ask you what is the information about, but they want a pen. I said, are you an author? Are you writing a book? And they watch me like I'm crazy. I said, because you pick up so many pens, but you're not asking me about the information. You need this information, and then when I start telling them, say, oh my God, do you know I experienced this? And do you know, I said, really now? You know, so we have to engage, people ask us stuff, and we just say, oh yes, you can have. But we have to get on the case.
Right.
Because at the end of the day, when things do happen, they come to you and they think that you're Jesus Christ, you're perform a miracle. Because they want this service now. And when, yeah, but you have to let them know, this is important. We're gonna give this to you. You know, that's just a courtesy, but we are here to give you this information that we know that you can use. And then we really have to band together, come together to really, we work for our older adults, because they are being taken advantage of. Last night I was listening to this series and all the millions of dollars that they have, lots of persons calling them, they have to be educated. You know, so we have to find, so we have to find a way, bring our seniors together, you know, and really educate them as to what they need to do, what phone calls that shit, because sometimes just say that they don't even watch the news, so they don't even know what's happening. You understand? So we have to come to a place where we could come together and bring them together and educate them. All right, go ahead, Ms. Love.
So I just wanna pass this around. I do, here you go, sis. I told you I do, older adult programming. And we're running a Golden Ages program at Antioch Baptist Church in, Bed-Stuy. We do that on the first and the third Tuesdays of the month from 11 to 2. We provide breakfast and lunch, as well as whatever programming, you know, for the day. And I have myself and other staff on site that helps, you know, do research and so on and so forth. We can do it, you know, through your phone. You need your SCREE application done, you need your DRE, you need your SNAP done. You jump on Access HRA and do it really quickly, you know. My elders trust me. I've been able to build that with them, so they don't mind bringing documents and me snapping pictures and, you know, so forth. So that's one thing. I gave out the other flyer a bit prematurely, because we're here in the community board on the first and the third Thursdays of the month to assist older adults in the neighborhood in accessing and completing paperwork as well. Francisca, I don't know if you got to other announcements yet, but we're also a drop-off location here for prom and graduation accessories, whether it's dresses, suits, ties, shoes. So there is a box in the front that will be accepting donations. And then the giveaway is on the 21st of May in partnership with Brooklyn Patrol Borough North. Patrol Borough Brooklyn North. Did I say it right? Yeah. In Bushwick. And so that's gonna be on the 21st. If everyone's okay with that, I'll share flyers and information via email. Also on June 1st, we're having our health and resource fair. CB9 will be at the Ronald McNair Park, over by Eastern Parkway, class in Washington.
Oh, that's nice.
So that QR code and that Google form should circulate, so you can register to table. And then on September 8th, just jumping ahead really quickly, just to put it out there, September 8th, we are doing a resource and health fair for Grandparents' Day at Downstate.
Oh,
So
Okay.
give me a rest of that, so I could come bring resources, and whatever that you're doing in the seniors,
Mhm.
that's
seniors,
good
for the older adults, let me know, because I usually go to a lot of the senior centers,
Mhm.
and I do presentation for them when it comes to housing, and they were just like, can you
Perfect,
please
yeah.
come back again, and they're very much into it, they really like it. So just let me know,
Yeah,
and so
absolutely.
I could pencil you in, so I could
Absolutely.
come.
And then let me know when we're doing the spa day again.
Yes, so I'll give you a call, so we can plan that.
Okay, yeah.
Yeah.
I think that was.
The senior, you were just saying the senior something at. I'm having a senior.
At Antioch? I'll go and make it
No, the one just 2 minutes ago,
Oh, the resource fair
the resource fair at
at Downstate. That's gonna be at
Downstate, so you
Downstate,
should
Sunday,
have the
September
DA's,
8th.
Sunday, September 8th, that sounds.
It's Grandparents' Day
September
Mhm.
8th at
at
Downstate.
Downstate.
I'm suggesting before we wrap up, would you
But I
like
was
to
gonna say
give
the
us
DA's office,
a
right,
little about
Yeah,
what you
absolutely.
do?
here in Crawford.
Mhm.
Yeah, sure.
Yeah.
No problem.
So I work for AHRC NYC, which is a large not-for-profit organization for people with intellectual developmental disabilities and their families. In my particular department, it's employment and business services, and we do job training, job placement, job retention services. The Brooklyn office is located at 81 Willoughby in downtown Brooklyn, but we do have other offices, an EBS office like mine in every borough. We have different training programs. We have a training program for out-of-school, out-of-work youth, age 16 to 24, in collaboration with DYCD. They have Without Walls program. We have a clubhouse, which is probably not going to be a clubhouse anymore just because of the recent RFP, and that was for people with dual diagnosis, with a serious mental illness diagnosis and intellectual disability diagnosis. We also have, this is just the broader AHRC things that we have.
What ages do you serve as far as youth? Do you serve like up to 35?
Well, it depends what service you're looking for, right? So we
For
do
the
have,
training and-
you have schools, for the training, it's 16 to 24.
Okay.
For that particular training, but we do have other trainings for people outside of that age range as well. They would just be into that program. There's respite programs, there are residences, we have 2 summer camps upstate, there's different recreation programs, we have early intervention programs, individual therapies, just a very wide range of services.
Okay, so we have the 71st person, and they make the third Thursday of every month, and sometimes they have some of the information that they're given that is just like vague, and then these are the type of information that the not just here, but the community really need to hear about, and even when we have the general membership meeting for the community board, you just come. There's just 3 minutes. You call in and you sign in because people need to know that those organizations and services are out there for persons to make use of. So I mean we are just here, but then I think there are more persons in the community, and then I'm just thinking as to what we can do to really have like a community forum and have services and even right in our district just to have something big where people can come, not nighttime, but during the day where persons could come, like even like we have the Carroll Gardens and we have the outdoors, where we can have, a big event where people could come out there and then everyone could come and give out information, because the community, our community is hungry for information. They don't have information, and when the little that they get is not much that they can do with it. And it's like services just getting worse in the community, so I think that is something we can work on, and so remember, whatever that you're planning for downstate rally meetings, send it out to CB 17, 14, 9, so we can come out there, and as we get the information, we pass it out.
Okay.
We can put it on our Facebook pages and just put it out there so more persons could come, because we don't want the shwi meeting, we want the outside meeting so everybody can be part of, and we can come together and support each other.
We also have an Instagram page, UUP Downstate, so.
What is it?
UUP Downstate. So we post a lot of things on there also. Whatever we know, we put it on our Instagram page also.
So I usually get stuff on my Facebook,
Yeah.
So anyone else have anything that they wish to share before we close?
Well, could you kind of keep, people of this committee, I mean, just like CB9 sends out their e-list, but maybe if we share some of our things with you, could you share it, circulate it to all of us, like? I don't know.
Sure.
That'd be
Sure.
helpful.
Yeah, because what we do, like we have your,
So what's the best email to?
you have your
email you with?
information. So what I did, so persons who really wanted, I think that you're on our WhatsApp chat as well.
Yeah.
So we created a WhatsApp chat.
Oh,
Right.
what's that?
Yeah,
I love
for
that.
health and social, for the health and social services. So we ask persons if they want to be part of it, so then we add the person's name. So if any information we have, we put it out there, and then, and vice versa. So if we want, we have your information, we can just add you to the WhatsApp chat,
Yes.
and then you can
What's
just.
the name of that chat? Cause I have it, but I don't remember the name of it.
You see, and you are part of the, because
I know.
you give the secretary your information as well.
Oh, here we go, BKCB9 Health something.
Yeah.
Okay, gotcha.
Okay, so if you have anything, a flyer or anything, just post it in there, you know, and then we'll get it
That's
and
even
send
better.
it
So I
out.
don't need the email.
Actually, it's.
I did wanna just say one thing really quickly. DCS is hosting our third Love Fest or Community Day, which is like a resource fair, June 21st. I can also share that, to the email.
Yeah, send it, yeah.
Yeah, but it's just like a resource where we're gonna have it open to the community. We're trying to have it real cute this year. So if anybody wants to come out and table or just attend, that'd be great.
It's New York, right?
Yeah, right in front of the
Wedding
office,
Pride.
yeah.
Okay. And just a reminder also, as you go out there and then you are dealing with persons outside there, our, we cover over 27 different categories of discrimination, right, across the board. So any issues that you have, don't hesitate, give me a call, housing, employment, public accommodation, it doesn't matter what it is. Just give me a call, because I tell persons, if it quacks like a duck, then it's a duck. You're not comfortable as to what's happening and you know something is wrong, so call me and within investigation, especially when it comes to our seniors. So just give me a call. We don't have to use your name or whatever, we do our own investigation and we'll do what we have to do. Right, and all our services, we have 20 attorneys, all our services, we are one of the administrative offices for the mayor's office. So everything that we offer is free. Attorneys are free, all the services are free. Okay? So this was a great conversation. Next month again, hopefully that I know maybe just not you guys will be coming, but I'm looking forward to seeing you guys. If you have any more to bring back to the table, please, you're welcome. Each one of you are welcome to be back at the table. Okay, I appreciate it, and I'm looking forward for us working together. And as usual, Miss Lady, she always brings so much information to the table. She's a pillar, strong pillar in the community, and I always admire you from years that you've been standing up for what is right in the community. Yeah.
Miss Cameron.
Always admire her stand in the community. Sometimes, sometimes persons may hear her and they should talk and they don't really, they just think that she's very forceful, but sometimes you need persons to be forceful in order for you to get things done.
My mother said I wasn't born with the scary gene.
Yeah. So thank you so much, and get home safely, and then we'll be talking. We'll be
My father used to
Yes.
tell
You
me.
want me to leave this here? This is a good pen, by the way, no one
This
took it.
one is
but
not working.
It have
Okay.
little post-its in it.
It has what in it? Why
Post-its
this
in
one
it.
not working?
Did you say Post-its?
And
I
this
know
one's
this-
got a bunch of different colors.
You have any more of these? That is so
Right.
cute.
I had a client who was told by a
Yeah.
board that they can't install a wheelchair ramp because
Oh, no,
it's like
no,
an
no.
hour